So these are the requirements that we need in performing baby bathing. While these are needed to perform cot care for the baby. So now I'm going to explain to the infant's father that I need to perform baby bathing to his baby, and right now I need to verify the baby's identity by checking the baby's tag on the leg. So now I proceed to the baby bathing station. Next, I'm going to put on plastic apron to keep my uniform dry. I'm pouring in hot water after cold water into the bath basin, and now I'm going to test the temperature of water using the elbow to ensure the water temperature is suitable for baby. Next, I'm assisting the father to undress the child to remove soiled clothes, and while doing that, I'm assessing the child's skin throughout the procedure to look out for any abnormalities. This is to provide further nursing intervention if there is sore buttock. Abnormalities such as jaundice, any signs of soreness of buttock wicks, desquamation, and many more are being assessed throughout this procedure. Next, I need to check for the child's buttock in case he has defecated. In this case, the baby has not defecated, so I just remove the napkin. All those dirty linen will be discarded to linen carrier. Now I'm wrapping the child with bath towel, exposing only the head. This is to reduce exposure to chill while performing baby bathing. Before cleaning the baby's face, I'm moistening the swabs with cold boiled water. Next, I will bring the babies to the bathing trolley to cleaning the baby's face by swabbing each eye from inner canthus to outer canthus and repeat on the other eye with new swab. Is cleaning the forehead. Swab bridge of nose down towards each cheek by using set motion to the back of the ear. Repeat on the other side of the face. Swabbing around the mouth is also necessary. Next, I'm exposing the baby's head to shampoo the head, and I will be tugging the infant securely under my armpit on my non-dominant side with the head supported by the palm of my non-dominant hand. This is to maintain safety of the infant at all times. I also covering the infant's both ears using the thumb and my middle finger of my non-dominant hand. This is to prevent water from entering the ears. Next, I'm shampooing the babies with my dominant hand while infant is held securely above bath basin and rinse hair thoroughly till clean. This is done to clean the hair. Next, I'm going to place the infant on his back in the cot. This is to provide safety and avoid fall injury. And then next, I need to loosen a corner of bath towel and dab infant's hair and scalp dry gently till dry. This is to dry the hair and scalp to minimize heat loss via evaporation. Next step is to expose infant's body by loosening the bath towel. This is to get the infant ready for cleansing of the body. Next is to apply shampoo on infant's body, both armpits and groin, back and lastly on the hands. Shampoo infant's hands last to prevent him from putting his shampooed hands into the mouth. Next step is to turn infant's body over slowly to clean the back. This is to rinse off the shampoo on the skin that can prevent drying and chafing of the skin. Not to forget to rinse the infant's body by placing my non-dominant hand under the infant's further armpit and hold firmly. Assist infant so that the head rests on the lower arm of my non-dominant hand again, and rinsing infant's body with clean water to rinse off the soap that remains on the body. Next is lift infant out of the basin carefully, similar to the way I place him inside the bath basin to prevent injury. I'm placing him inside the baby cot and dab him thoroughly with bath towel to minimize heat loss and prevent hypothermia. Next, I'm wrapping the baby back using the bath towel to prepare for performing the cord care. I will be placing the baby inside his baby cot to prevent risk for fall. First and foremost, I'm performing hand hygiene by using hand rub to reduce transmission of microorganisms and prevent infection. Next step is to put on gloves to reduce transmission of microorganisms and prevent infection towards the baby. Next, I'm preparing some swabs and I am wetting it with spirit Hibiten and separate it into another gallipot to prevent contamination of the swabs. Exposing the umbilical cord is important to ensure effective cleaning. I also need to hold the umbilical stump with non-dominant hand and not pulling the cord to steady the cord. And then before anything, just now I just observe condition of the cord to detect signs of infection like redness, swelling, and presence of smelly discharge. And I'm cleaning the cord with firm strokes by using my dominant hand to pick one swab each time to cleanse and discard. And I'm picking new swab without contaminating other swabs to maintain clean technique and to prevent contamination of the clean swabs. After I'm done with cleaning the cord, I am discarding the bath towel by putting it into the linen carrier. Next, I'm dressing up the infant neatly with the clean layer as prepared earlier on by putting on diaper and clothing. Since the infant has short fingernails, hence I'm not applying mittens to cover it. Next, I'm putting on the baby's shirt, and after doing so, I will be wrapping the baby in towel, exposing only the face, as this will keep the infant warm and infant will feel secure when being wrapped up. Next, I am discarding the glove to reduce transmission of microorganisms. Not to forget to also discard my apron to reduce transmission of microorganisms too. After I have washed my hands, I am handing over the infant to the father. I will also be advising the father to give the infant to the mother for breastfeeding. This is to promote maternal and child bonding. That's all from me. Thank you.